Hi everyone, this is Shireen Adlam again. Thanks for joining me in this short presentation to learn more about the clinical experience and education you will get as a fellow here at Emory. Let me first start by introducing our program leadership team. I just took over the program leadership from David Schulman after having served as associate program director for about 8 years. We also have four wonderful associate program directors, Dr. Cherry Wanterkool, Dr. Annette Esper, Dr. Sushma Cribbs, and Dr. Lisa Daniels, who is the critical care track APD. Last but not least, Alice Mousson Wood is our program coordinator, who works tirelessly behind the scenes to make everything run smoothly. Emory is home to the Emory Critical Care Center, which is the entity that encompasses all critical care units and activities that happen at our institution. It's comprised of 40 intensive care physicians, 450 critical care nurses, and 60 affiliate providers. Each of these have a special interest and training in the care of critically ill patients. From the pulmonary standpoint, things are just as diverse as our own pulmonary division is also home to a large number of faculty members with different career focus and expertise. What this means to you is that as a critical care and pulmonary critical care fellow at Emory, you'll be working side by side with a diverse group of faculty with different patient populations and in different campuses, each of these bringing a particularly valuable experience to your training. This is the most distinguishing feature of our program and one that will give you a superior clinical training. So let me tell you a little bit more about the 5 different sites you'll be working at. The first is the Emory University Hospital, which is a large tertiary care facility that serves as a regional referral center and gives the fellows exposure to complex cases and access to cutting-edge technology. The patient population seen at EUH tends to have a subspecialty focus, such as solid organ transplants, bone marrow transplants, complex hematology oncology patients, rheumatologic diseases, and advanced lung disease patients. Our surgical ICU and cardiothoracic ICU rotations at UH allow fellows to rotate with faculty with a surgery and anesthesia critical care background. It's on this campus that our fellows have the ability to get the most experience with ECMO cannulation and management. Grady Memorial Hospital is our second site and probably our most notorious site for Emory outsiders. Grady is one of the oldest and largest public hospitals in the nation and serves as the safety net hospital for our in-town underserved population. Rotations at Grady include pulmonary inpatient consults, a medical ICU, a trauma and a burn ICU, as well as a neurosurgical ICU, among others. I can safely say that the Grady Medical ICU is our fellows' favorite medical ICU rotation, if not their favorite rotation, period. There, they enjoy the diverse pathology that they get exposed to, they value the opportunity to care for the underserved, and they appreciate the autonomy that they get during that rotation. Autonomy with patient management decisions, resident teaching, and leading the medical teams made up of residents, interns, and medical students. Our third site is Emory St. Joseph's Hospital, which is the oldest hospital in Atlanta and until very recently used to be a privately owned hospital. It was renowned for its cardiovascular care and intensive care. In the past few years, Emory Healthcare has acquired this hospital, and we started deploying our fellows there initially as a test. But the rotations there were so popular with our fellows that we decided to continue the deployment. The ICU experience at Emory St. Joseph's Hospital allows the fellows to have one-on-one time with their attendings without the presence of residents or other learners. The fellows function as a junior attending, leading teams of advanced practice providers. Another unique rotation at St. Joseph's Hospital is the electronic ICU, or EICU, or tele-ICU, where fellows work alongside attendings and a team of specially trained ICU nurses to provide remote intensivist night support to all ICUs in the Emory healthcare system. Our fourth site is the Emory Midtown Hospital, which has a semi-private model where academic physicians work side by side with private practice physicians. EUH Midtown is where the obstetrics and gynecology practices are located, and the ICU offers a mix of patients, including bread and butter critical care, as well as exposure to obstetrics emergencies. And finally, our last site is the Atlanta VA Medical Center, which is a very busy referral VA center for our region. This site includes a state-of-the-art sleep center that fellows get to rotate through. Other rotations here include a semi-urgent pulmonary clinic where fellows get most of their bronchoscopy procedures during their first year, including endobronchial ultrasound. The VA is also home to a handful of our faculty research mentors. As a critical care fellow at Emory, you work directly alongside faculty members who are boarded in critical care medicine and several other subspecialties. In our own pulmonary and critical care medicine division, faculty members will have additional board certification in pulmonary medicine, nephrology, infectious diseases, internal medicine, as well as emergency medicine. But you'll also work with faculty outside of our division who are boarded in neurology, anesthesia, and surgery. This broad exposure will give you a well-rounded education and exposure to the multidisciplinary nature of critical care. Your exposure in the pulmonary world will be just as varied. Our division features subspecialty teams for almost any disease state you can imagine, including cystic fibrosis, pulmonary hypertension, interventional pulmonology, interstitial and rare lung diseases, a busy lung transplantation program, sleep disorders, and obstructive lung diseases, including an allergy and immunology center. One thing I can definitely promise you is that you'll not want for any procedures while training with us. By the time you graduate, you'll achieve competency in all of the required procedures which are listed here. Any prior experience that you have is counted towards your procedural requirements during your fellowship. Our fellows are required to attend weekly didactics. These consist of pulmonary grand rounds, which occur at 7:30 every Tuesday morning, followed by the Fellows Core Curriculum Lecture Series, a 2-hour lecture then interactive session. There are also subspecialty conferences occurring throughout the week, and that fellows can attend depending on their interest or the rotation that they're on at the time. Our pulmonary continuity clinics take place at the VA and Grady, with each fellow having a continuity clinic at each site on alternating weeks. We have chosen not to assign a specific clinic site to our fellows as other places do, because we feel that the patient population and pathology that one gets to experience at each site is unique in its own way, and we felt strongly that the fellows' experience would gain from experiencing clinic at both campuses. So as you can see, training at Emory will give you a very diverse exposure. This is our main strength and distinguishing feature. Through this diversity of exposure, we hope to help you find your own passion. Once you do, our program allows you a lot of flexibility through a choice of different tracks and elective rotations, so you can customize your training to meet your own career goals. So we have just covered the basics of our PCCM fellowship structure here at Emory. I'll stop here and hope you'll join me on the next 2 short presentations to learn more about the details of the different tracks or pathways offered through our program, as well as about additional educational opportunities available to you as a fellow at Emory.